Let's rotate the heart laterally so that we can have a better view of the right lateral atrium and the ventricle. Note the smaller vessels that feed off of the main RCA. Now, these smaller vessels contribute to the perfusion of the entire right lateral ventricle. Rotating the heart to the posterior position, note two important vessels, the circumflex and the posterior descending artery. The circumflex is a branch of the left coronary artery, providing blood flow to the posterior portion of the left ventricle. Comparatively, the posterior descending artery provides perfusion to the posterior right ventricle and the posterior septum. Rotating slightly lateral, we can view the left lateral portion of the heart. The left lateral portion is very important. Recalling from your basic anatomy, the left ventricle provides oxygenated blood to the rest of the body. To this requirement, the left ventricle is larger, faces greater hemodynamic pressures, and has higher intraventricular pressures than the right ventricle. We'll discuss this later in the module. Let's review some fundamental principles of coronary circulation. Firstly, myocardial perfusion. Remember, myocardial perfusion only occurs during the ventricular diastole phase of the cardiac cycle. No perfusion occurs during systole. Myocardial perfusion also is affected by heart rate and blood pressure. You know this by the formula of cardiac output equals heart rate times stroke volume. So tachycardia, or increased heart rate, decreases filling time and perfusion and also increases oxygen demand. Bradycardia, or slow heart rates, provide slow filling and also decrease perfusion. In cases and events of hypotension, there is of course decreased perfusion through the coronary circulation. Let's utilize this cardiac model for our review of anatomy. We'll canvass the external myocardial surface first. As you can see, the heart is slightly tilted. It's much different than you may have seen in textbooks. Notice the axis rotates toward your right. In reality, this is what we would see if we were to view the heart in a human model. The majority of the anterior portion is comprised of the right ventricle. Due to this rotation, the left ventricle is only slightly visible from the anterior perspective. Coronary arteries can also be visualized on the external surface of the myocardium. The vessels supply oxygen to the tissue. The right coronary artery works in concert with the left coronary artery and supplies 200 to 250 cc's of blood per minute to the myocardium. The RCA supplies about 15% of this total blood volume. The RCA also supplies blood to both the right atrium and the ventricle. The inferior portion of the right ventricle is also perfused by the RCA, and this will be important to remember later in this module when discussing location of ischemic events.